Hi, it's Dr. Matt Russell from VSON. If you're thinking about vision correction, in this video, I'll answer the common question, when will you start to see after lens replacement surgery? Well, you may be very surprised to hear that you'll actually start seeing as soon as you wake up after lens replacement surgery. The vision to start with, of course, is quite blurry because you've just had drops in to dilate your pupil, and these drops will take about 24 hours to wear off. Your vision will be good enough to get around without any difficulty. Because of your dilated pupils, however, you will notice a lot of halos and glare in the first 24 hours, and that's quite normal. It takes a few days before the vision is very clear. It usually takes about 3 to 4 days. Typically, you can start driving on post-op day 2. That's not the day after surgery, but the day after that. The near vision recovery depends on the type of artificial lens that was used during the lens replacement surgery. Many patients will have at least one multifocal intraocular lens. The near vision in people that have had multifocal intraocular lens usually takes several days to begin to improve. Normally, most patients are reading comfortably by 5 to 7 days after surgery. You may need a pair of magnifiers in the first week after surgery, especially if you're returning to intensive computer work or reading. So after a few days following the surgery, most people are enjoying very good distance vision, and by the end of the first week, the near vision is working very nicely. You may find that there are adjustments that need to take place. If you were very short-sighted before surgery, you may need to hold your book or phone a little further away from you than you were before, usually about 30 to 40 centimeters. Some people may need to sit a little closer to their computer monitor, and usually somewhere between 60 and 70 centimeters works perfectly. In the first week, you may notice the quality of your reading vision fluctuates. Words may appear to be blurred or run into each other and then sharpen after blinking. The surface of the eye is typically drier than normal in this phase of recovery, and that gradually improves. Some people may notice shimmering of their vision, and this is because it takes a few days for the new intraocular lens to completely stabilize inside the eye, and until this happens, the lens vibrates slightly with minor eye movements. The quality of the reading vision particularly, and the quality of the vision in general, continues to improve as the eye heals over the first few weeks after surgery. Now, most people who have multifocal implants will notice halos around lights, particularly when driving at night, and they may also notice halos around downlights and other indoor lighting. The intensity of the halos varies greatly from one person to another. Early after surgery, 70% of patients would rate their halos as mild, 20% would rate them as moderate, and 10% would rate them as being quite severe. Most people are able to start driving at night from the first few days after surgery, but some people are going to have difficulty in the first few weeks. The halos diminish in most people over a 3 to 4 month time frame, to the point that they would rate their halos as mild or minimal. For a small portion of people, the halos remain prominent, and 1% of patients may have persistent severe halos and may even elect to have further treatment to eliminate these halos. It is really important to remember that in order to achieve your best results after lens replacement surgery, you may need laser vision correction if you have a small residual prescription after the initial surgery is done. In this case, the vision will be quite good, but you may notice that the distance vision is not perfect. You may need to position print a little further away than what you would really feel comfortable doing, and most of the time glasses are not required in this situation. However, some people would benefit from short-term use of reading glasses, usually just simply magnifiers that you could get over the counter. Laser vision correction, either with LASIK or PRK, is performed at 3 or 4 months after the initial surgery to enhance the vision result. The vision is typically quite sharp following laser vision correction if performed with LASIK after about 24 hours, but improves more gradually if PRK surgery is required. So most people after lens replacement surgery are beginning to see well within 2 days of the surgery, and they're reading quite well by the end of the first week, all without glasses. Patients who are doing this, who form the vast majority of patients who go through this particular type of surgery, are generally delighted, as this is the first time they've been able to read without glasses and see in the distance without glasses for many years. The vision quality usually improves gradually over the first few weeks, and there's a group of patients who need to wait for additional laser treatment to get the result they anticipated. Laser correction is commonly part of the whole process of achieving spectacle independence, and is usually performed about 3 or 4 months after the original surgery. The best way to know if you're a suitable candidate for LASIK or any form of vision correction we offer is to book a free laser vision assessment. You can book the appointment directly on our website, or you can call us if you prefer. You can even scan the QR code you see on the screen right now, which will link you directly to our online calendar where you can choose a time and date that suits you for a free initial assessment.